Hi, I'm Dr. David Gonzalez. I am Assistant Professor of Orthopedic Surgery at Montefiore Medical Center and Director of Sports Medicine. Today we're talking about superior labral anterior to posterior tears, or SLAP tears. And this is a condition whereby a tissue called the labrum tears off the socket. And this area of the shoulder has a bad area of blood supply, or poor blood supply, and so it's prone to injury, prone to tearing. This injury is commonly seen in pitchers in baseball, and usually the overhead throwing position puts the shoulder at a certain stress during the motion of throwing, and that predisposes the shoulder to tearing in this region, particularly with overthrowing or repetitive throwing. So this injury is common in baseball, but it can occur in any sport where there is throwing, and then of course any sport where there may be a collision or a fall onto an outstretched hand. Typically the patients present with pain. They can present with a sensation of catching in the shoulder. Also the patients may just describe that they've lost the control of the pitch, or they can't throw as hard as they used to. Typically we start with conservative treatment, and if we see that there's no improvement in that, then we may order an MRI of the shoulder. An MRI of the shoulder will show us the labral tear and any other associated injuries. Ideally, the MRI is performed with contrast, and that will show up the tear a little bit more accurately. Generally speaking, in an athlete, particularly an overhead thrower, resting from the activity usually allows these to improve or heal. One thing we want to make sure is that the athlete does not just continue to pitch through pain, which may actually make things worse. First of all, it will not allow the tear to heal, and in actuality it may make the tear possibly extend and become larger. And there may be other associated injuries that may come about over time if you continue to pitch through pain. So rest is an important part of the treatment initially for a SLAP tear. The majority of patients do improve with conservative treatment. Occasionally someone with a SLAP tear will need surgery because they're not improving with the conservative treatment. And the surgery for this, which is what I'm demonstrating on the video, involves small incisions around the shoulder, a minimally invasive type of procedure. And we insert a camera into the shoulder, find the tear, and then we either shave it, which is called debridement, or we may actually repair it by suturing it back to place. Okay, so here we are inside the shoulder joint, and you can see the ball of the shoulder and the cup of the shoulder. At the very edge, you can see the tissue that we call labrum. And here I am showing a probe which shows where the area of tearing is in the labrum, consistent with a SLAP tear. And here we are preparing the labrum for the repair. And here we are repairing the SLAP tear. We have placed anchors, which are small implants that have suture within them, and now the suture material is utilized to sew the labrum back to the glenoid, or the socket. And here we sew around the labrum from top to bottom, from front to back, and this brings the labrum right up against the bone so that it can heal. This is an outpatient procedure. After the surgery, usually there's a period of rest followed by physical therapy for recuperation, and full recuperation is approximately 3 to 6 months before returning to sport.